Hello, and welcome to the Syneron Candela series of exclusive webinars created to help you grow your practice with the newest aesthetic technology. Tonight's webinar is entitled Laser Procedures to Grow Your Practice Using the Vbeam Perfecta and GentleMax Pro with Dr. Stephen Eubanks. Dr. Eubanks is a board-certified dermatologist with a full-service practice in Denver, Colorado that includes skin cancer surgery as well as standard and cosmetic dermatology. Dr. Eubanks has extensive experience in skin laser surgery and is considered a pioneer in laser skin resurfacing. Our topic is how to optimize the use of the Vbeam Perfecta and GentleMax Pro lasers, treating vascular lesions, pigmented lesions, hair removal, and skin rejuvenation. We will present treatment approaches and procedures to help you grow your practice. During the webcast, questions can be relayed to Dr. Eubanks and Syneron Candela representatives by clicking the Ask a Question button. Upon the completion of the webinar, please take a few moments to fill out our survey. And now, Dr. Eubanks.
I'm Steve Eubanks, and I'm a dermatologist in Denver, Colorado. Tonight I'm going to talk about laser procedures that will help grow your practices. What I'm going to do is show you how I optimize my lasers to treat vascular lesions, pigmented lesions, hair removal, and skin rejuvenation. What do I mean when I say I'm optimizing my lasers to grow a practice? That's somewhat of a strange statement. What I mean when I say I'm optimizing them, that means finding more things to do with a laser that you may have just purchased thinking that it would only do one job. I'm going to show you how many different applications each of these lasers have. The lasers that I'm going to discuss today are the Vbeam Perfecta and the GentleMax Pro. So we'll start with the Vbeam Perfecta. What is this laser? This is a pulse dye laser, and it's set at 595 nanometers, which is a yellow light. So why did they pick 595? The first pulse dye lasers were set at 577 nanometers because that really corresponds to the peak of the absorption of hemoglobin. And then they switched to 585. But both of these wavelengths were far too well absorbed by hemoglobin, and they didn't penetrate very well. So what we saw, there was actually damage to the normal capillaries that fill the dermal papilla, and that was an unwanted problem. So a lot of energy was absorbed before it got to the pathology. So why is 595 different? Number one, it penetrates much deeper, and it's a little less absorbed, so it's not as apt to be absorbed by unwanted normal blood vessels and better absorbed by the pathology, which is actually deeper into the skin. Another new advantage with the Vbeam Perfecta is what they call 8 micropulses per pulse. What does this mean? This means that when you think you're firing the laser once, you're actually firing 8 separate pulses. And why do they do that? Well, what they're trying to do is get a total higher energy with each pulse without any of the pulses going above what we call the purpuric threshold. So if we look at the next slide, this just shows an example of how in the old 4-pulse technology, often some pulses were higher than that purpuric threshold. What do I mean by purpura? This first photo is a pre-treatment, untreated. And this is what we used to get. This happened to be Candela's SPTL1A with my original laser. And every pulse turned dark purple with a bruise. And the new lasers basically get no bruising. I happened to show a picture that had a couple, just so you wouldn't think I hadn't treated this patient at all. The next thing that the Vbeam Perfecta has is what we call variable pulse duration, or how long is each pulse lasting when you fire it. Why do you care about how long the pulse is? Well, when we do 1.5 to 3 milliseconds, or thousandths of a second, you always get purpura, even with this device. If we lengthen the pulse to 6 to 10 milliseconds, I almost never see purpura. I don't expect to ever see purpura. And if we go much longer than that, there's no chance whatsoever. But why would we do longer pulses? Some people say, well, if you don't get purpura, you don't get results. That's absolutely not the case with the newer laser with the multiple subpulses. You should be able to completely treat a lesion without getting purpura in today's technology. The next thing that the Vbeam Perfecta has is what we call dynamic cooling using the dynamic cooling device, or DCD. This has long been the hallmark of Candela lasers. Basically, all of their lasers have used DCD cooling. So what is that? Well, you spray a cryogen or a cooling spray onto the surface of the skin, and then you have a delay, and then you fire the laser pulse through that area of cooling. This just shows the actual cryogen spray being sprayed. I only include this picture because in the old days to take a digital picture of something was almost impossible to catch it, and it took me about 40 photographs before I could get this showing the actual cryogen filling the target area. But what this slide does show you is what great visibility you have, because the target would be in the center of that ring, and you'd see it very well. So why do we use cooling or DCD at all? What we're really doing with it is protecting the epidermis. We're not really trying to reduce pain and discomfort. It's all about protecting the epidermis. Why do we care about the epidermis being protected? It's because if you protect it, you're not going to get damage to the pigment cells that reside in the lower part of the epidermis. So this, again, is all about protection more than it is pain relief. And the last feature that the Vbeam Perfecta has is what we call the Pigmented Lesion Handpiece. This is new with this laser. When you look at a picture of this, all this is a convex crystal. Convex means it goes out. And if you look at the next diagram, what you're trying to do with this convex crystal is you compress the compressible target. Remember, pulse dye at 595 can be absorbed by both melanin and hemoglobin. So this is an incredible low-tech way of getting rid of one of those two targets. By pushing and compressing away the blood, it's no longer in the path of the laser. When the laser fires, and all that it sees is the pigment. So again, I'm just amazed at what a low-tech way of treating this pigment is using the same wavelength. So all this being said, what do I do with the Vbeam? So when the pulse dye lasers were first invented, they were invented to treat port wine stains or red-purple birthmarks, and they still are extremely effective for this. This is an example of an adult, has a thicker port wine stain, has a few nodules. You can now completely clear adult port wine stains with a Vbeam Perfecta. Here's another example of a really thickened port wine stain. In the old days with 585, we really never could get these thicker port wine stains to respond, and they do well now. And I always show pictures of babies because that's what it was designed for, is to treat infantile port wine stains. I start treating babies usually about 3 months of age. Another picture of making a real difference in the young life of this patient who had a significant cosmetic problem with his port wine stain. What else can be treated? We can treat what we call Capillary Hemangiomas. Now, these are lesions, and I know there is a newer name that names in dermatology are constantly changing, but I still think of these as Capillary Hemangiomas. These are the lesions that are not really present at birth, that grow very quickly. And then if left alone, within 2 years, they usually resolve. Parents aren't all that excited about having this big red lesion in the middle of the forehead of their beautiful young child. So what we can do is we treat these patients every 2 weeks, and within about 6 treatments, we can almost always get them to resolve. Another really great treatment with the pulse dye Vbeam Perfecta is Poikiloderma Savate. Savate, I believe, is a French dermatologist. And what poikiloderma is, if you look at the next slide, it's just a red discoloration of the neck. And I did a study about the time I took these photographs where I had 10 patients, treated all of them with the Vbeam, and every single one of them completely resolved. And although this is just a cosmetic condition, it's very well treated with Vbeam Perfecta. Then there are leg veins. As you can see from the next photograph, Vbeam at 595 is very effective at treating leg veins. The patients I treat with Vbeam are very light-skinned, Fitzpatrick type 1 or 2, and they have small red vessels. I think darker skin and larger blood vessels don't respond as well to Vbeam. But you can get slightly purple lesions to resolve, as you see in this next photograph. And I left some of the vessels just so we could monitor which ones disappeared. And on the left side of the photograph, you can see that cluster that's completely gone, but the vertical vein right next to it is still there, so we can realize where we were on this picture. And one of the things this photograph shows is what we call telangiectatic matting, which is that darker red patch of tiny vessels that we often will see with following saline sclerotherapy. Once you get matting, I think the only treatment that works at all is laser treatment, and these completely resolve. I think facial telangiectasias are one of the best treatments using the